Now our group will explain how water is eliminated from body.
I'll be discussing the process of filtration that occurs in the kidneys, specifically in the glomerulus and Bowman's capsule. This process begins in the structure known as glomerulus, where smaller molecules are filtered from the blood into the Bowman's capsule. This filtration process involves the afferent and efferent arterioles. The afferent arterioles, which carries blood into the glomerulus, is larger than the efferent arterioles, which carries the blood away. This size difference creates high hydrostatic pressure within the glomerular capillaries, which is essential for driving the filtration process. This pressure forces fluid from the glomerular capillaries into the Bowman's capsule. So, what exactly gets filtered through this system? The filtrate, which form in the lumen of the Bowman's capsule, contains water, sodium chloride, glucose, amino acid. However, not everything passes through this filtration process. Larger molecules like protein and blood cells are too big to pass through the filtration slits, so they remain in the blood.
Reabsorption of the glomerular filtrate occur along the renal tubule. The dissolved substances permeate across the renal tubular walls into the blood capillary network. In the proximal convoluted tubule, sodium ions are actively pumped into the blood capillary network, and chloride ions are passively absorbed. The reabsorption of 100% glucose and amino acid also occur through active transport. The movement of dissolved substances into the blood capillary network reduces the concentration of dissolved substances in the glomerular filtrate, but increases the concentration of dissolved substances in the blood capillary. As a result, water enters the blood capillary through osmosis.
Moving on to the reabsorption of water, a countercurrent multiplier system is used in the loop of Henle, which can be explained by the phrase water follows sodium. There are two kinds of reabsorption. In the proximal convoluted tube, some water is reabsorbed along with nutrients. When descending the arm loop of Henle, water is transported passively through osmosis. Going up the arm loop of Henle, no water is reabsorbed, but sodium chloride is actively transported, which causes the medulla to be salty and allows osmosis when filtrate travels down the arm loop of Henle. After ascending the loop of Henle, filtrate is at its most dilute and is hyperosmotic to the interstitial fluid. This part of reabsorption is called obligate reabsorption. As water travels through the distal convoluted tube and collecting duct, antidiuretic hormone or ADH is secreted by the pituitary gland to help reabsorption of water. This is called facultative reabsorption.
Now, we'll move on to secretion. The secretion occurs in mainly three areas: the proximal convoluted tubule, distal convoluted tubule, and the collecting duct. The substances are actively transferred. Let me repeat, actively transferred into capillaries around the nephron, then to the glomerular filtrate. Remember, glomerular filtrate are the substances that has passed through the glomerulus. Secretion allows blood pH to be controlled, which is by balancing the secretion of hydrogen ions and reabsorption of the bicarbonate ions. What are the wastes involved? Nitrogenous wastes such as urea, ammonia, uric acid, and creatinine. Ions such as hydrogen ions and potassium ions. Drugs, and followed by foreign substances.
Finally, I will be explaining about the excretion process. So, when the renal fluid reaches the collecting duct, only a small amount of salts are left, and most of the water has been absorbed back into the bloodstream. The remaining renal fluid is now called as urine. The urine will flow down the collecting duct, and here, a small amount of urea diffuses out into the surrounding fluid and blood capillaries due to its small molecular size. At last, after leaving the collecting duct, The urine flows through the ureter, bladder, urethra, and is finally excreted out of our body.